Are your legs and feet sending you a secret message? A warning signal you shouldn't ignore? Many of us in our 40s dismiss aches and swelling as just part of getting older or a long day on our feet. But what if those subtle signs are your body's way of sounding a critical alarm about your heart? Today, we're delving into a topic that is often overlooked in this age group but is crucially important. We're going to uncover 12 signs of congestive heart failure that can manifest in your legs and feet, signs that people in their 40s should never, ever ignore. These aren't just abstract health facts. These are life-saving clues that could protect your heart and preserve your future. Stay with us, because what you learn in the next few minutes could make all the difference. First on our list, and perhaps the most well-known sign, is persistent swelling, medically known as edema. You might notice your shoes feeling tighter than usual, or see imprints left on your skin from your socks long after you've taken them off. This isn't just random puffiness. In congestive heart failure, the heart's pumping action becomes less efficient. This weakness means it can't pump blood out to the body as effectively, and it struggles to get blood back from the extremities. Gravity takes over, causing fluid to pool in the lowest parts of your body, your feet, ankles, and lower legs. While many things can cause swelling, the edema associated with heart failure is often pitting. This means if you press a finger into the swollen area for a few seconds, an indentation or pit will remain after you remove your finger. If you're experiencing this kind of persistent, pitting edema, it's a significant red flag. The second sign is a sudden, unexplained weight gain. You might step on the scale and see you've gained 3, 4, or even 5 pounds in just a couple of days, even though your diet and exercise habits haven't changed. This isn't fat, it's fluid. That same process causing your ankles to swell is happening throughout your body. The failing heart and struggling kidneys lead to widespread fluid retention. For someone in their 40s who is otherwise active and health-conscious, this rapid gain can be baffling. It's easy to blame it on a salty meal or hormonal fluctuations. But when it happens quickly and is accompanied by swelling in your legs, it warrants immediate medical attention. It's a quantifiable measure of how much extra fluid your body is holding on to, and a direct indicator that your heart may be in distress. Number 3 is a feeling of heaviness or fatigue in your legs. This isn't the typical muscle soreness after a tough workout. It's a profound, deep-seated weariness that makes your legs feel like they're made of lead. Simple activities like walking up a flight of stairs or even just crossing a room can feel like a monumental effort. This happens because congestive heart failure reduces the amount of oxygen-rich blood circulating to your muscles. Your leg muscles, being large and hard-working, are among the first to feel this deficit. They are literally being starved of the oxygen and nutrients they need to function properly. Dismissing this as just being out of shape is a common mistake for people in their 40s, but it's a symptom that demands closer inspection, especially if it's a new or worsening sensation. Next, at number 4, we have shortness of breath during activity, which is medically termed dyspnea. You might find yourself getting winded from activities that used to be easy, like carrying groceries or walking the dog. As the heart struggles to pump blood forward, fluid can back up into the lungs, a condition known as pulmonary congestion. This makes it difficult for your lungs to expand fully and exchange oxygen efficiently. So, while the problem originates in your heart, you feel it in your breathing. This symptom is particularly telling when it occurs with leg swelling or fatigue. It connects the dots, showing that the circulatory system as a whole is under strain, from your heart and lungs all the way down to your legs. The fifth sign is one that can be particularly disruptive: shortness of breath when lying down, a condition called orthopnea. Do you find yourself needing to prop your head up with 2 or 3 pillows just to breathe comfortably at night? When you lie flat, the fluid that gravity had pulled down into your legs and feet during the day redistributes throughout your body. This fluid can then accumulate in your lungs, creating that same sensation of breathlessness. You might even wake up suddenly in the night, gasping for air. This is a very specific and serious sign that your heart is failing to manage the body's fluid load when you're at rest. Sign number 6 is the appearance of cool or cold skin on your feet and legs. When you touch your feet, do they feel noticeably colder than the rest of your body, even when you're in a warm environment? This occurs because when the heart is struggling, the body intelligently redirects blood flow away from the extremities to prioritize the vital organs like the brain and the heart itself. Your feet and legs are at the end of the line, so they receive less warm, oxygenated blood. This results in a drop in skin temperature. It's your body's survival mechanism kicking in, but it's also a clear signal of compromised circulation linked to poor heart function. At number 7, we have changes in skin color, or appearance. As circulation diminishes, the skin on your legs and feet might take on a pale, bluish or purplish tinge, a condition known as cyanosis. This discoloration is a direct result of the lack of oxygen in the blood reaching these areas. In more advanced stages, you might notice the skin becoming shiny, thin, or stretched over swollen areas. Some people also develop a brownish discoloration on their lower legs, called stasis dermatitis, which is caused by chronic fluid leakage from the veins into the skin tissue. These are not simple cosmetic issues. They are visible evidence of a deep-seated circulatory problem. Number 8 is a persistent, nagging cough, especially when you're lying down. This might seem unrelated to your legs, but it's part of the same systemic issue. Just like shortness of breath, a chronic cough can be caused by fluid backing up into the lungs from the failing heart. It's often a dry, hacking cough, but sometimes it can produce a white or pink-tinged foamy phlegm. Because it can be easily mistaken for allergies, a lingering cold, or asthma, many people in their 40s don't connect it to their heart. However, if you have this cough along with leg swelling or fatigue, it creates a compelling clinical picture of congestive heart failure. Coming in at number 9 is leg cramps, especially at night. While many things can cause leg cramps, those associated with heart failure have a specific cause. The combination of fluid buildup and poor circulation can disrupt the balance of electrolytes, minerals like sodium, potassium, and magnesium, in your muscle tissues. This imbalance can trigger painful, involuntary muscle contractions and spasms. You might be woken up from a deep sleep by a sudden, sharp pain in your calf or foot. If these cramps are a new and frequent occurrence, particularly alongside other symptoms on this list, they shouldn't be ignored. 10th on our list is a loss of hair on the legs and feet. This is a more subtle, long-term sign of poor circulation. Hair follicles require a steady supply of oxygen and nutrients from the blood to grow and thrive. When peripheral circulation is chronically impaired due to a weak heart, the hair follicles on the lower legs and feet can become dormant or die off. You may notice that the hair on your shins, ankles, and toes becomes sparse or disappears altogether. While this can be a natural part of aging for some, its onset in your 40s, especially if coupled with cold feet or skin changes, can indicate an underlying circulatory issue like heart failure. The 11th sign is the slow healing of sores or wounds on your legs and feet. Have you noticed that a small cut or scrape on your ankle takes weeks to heal instead of days? This is a direct consequence of inadequate blood flow. The healing process is incredibly demanding, requiring a rich supply of oxygen, nutrients, and immune cells, all of which are transported by the blood. When heart failure compromises circulation, the body's ability to repair itself is severely hampered. This not only slows healing but also increases the risk of infection, turning a minor injury into a major medical problem. Finally, at number 12 is nocturia, or the need to urinate frequently at night. This is another symptom that connects the dots between fluid retention and a failing heart. During the day, while you're upright, fluid accumulates in your legs. When you lie down to sleep, this retained fluid moves from your legs back into your bloodstream. Your kidneys, sensing this increase in fluid volume, kick into high gear to filter it out and produce more urine. This can lead to waking up multiple times during the night to use the bathroom. Many people attribute this to drinking too much before bed or an aging bladder, but in the context of congestive heart failure, it's a key sign of the body's nightly struggle to offload excess fluid. These 12 signs, from swollen ankles to a nighttime cough, paint a picture of a body under immense strain. In your 40s, it's easy to dismiss these whispers as the normal creaks and groans of getting older. But they are not. They are urgent messages from your heart. Recognizing these symptoms for what they are, potential signs of congestive heart failure, is the first and most critical step. Early diagnosis and treatment can dramatically improve outcomes, helping to manage symptoms, slow the progression of the disease, and protect your quality of life for years to come. Do not let a misconception about age keep you from listening to what your body is trying to tell you. Thank you for joining us today. We hope this information empowers you to be more proactive about your health and to recognize the subtle but crucial signs your body might be sending. If you found this video helpful, please give it a thumbs up and share it with others who might benefit from this knowledge. And don't forget to subscribe and click the notification bell so you won't miss our next video.